Hi, I'm Dr. Marty Ross. In this video, I talk about mitochondria dysfunction as a leading cause of low energy in Lyme disease. At about 6 to 9 months into Lyme disease treatment, if your energy is still really low, I suggest doing repair work for this. And in the video, I describe what mitochondria are, how they function, how they get injured in Lyme disease, and I give you 4 things you can do to help repair mitochondria function. At the end of the video, after you're done listening to it, read the description of the video and click on the link to a written article I have that gives you the dosing on all of the supplements that I describe. Treat Lyme is supported by purchases you make through Marty Ross MD supplements. Mitochondria are your energy factories. And we estimate there's about 300 to 400 mitochondria in a cell. Inside your mitochondria is where fat and sugar are burned through a bunch of chemical reactions into cell fuel. Cell fuel is something called ATP. Okay? All right. So that's what a mitochondria is. In Lyme and in chronic infections, those mitochondria can get injured. And specifically, the covering of the mitochondria can get injured. That covering is made up of a double layer of fat. And when you have chronic infection in you, that leads to an oxidizing state where the immune system, in trying to get rid of germs, is releasing oxidizing agents that can sometimes do some damage to the mitochondria membrane. All right. So my practice was, whenever I was treating somebody, and we were about 6 to 9 months into treatment with antibiotics and doing hormone support with like ashwagandha, for instance, and making sure they got sleep and knocking cytokines down with curcumin. All those things are built into my Ross Lyme support protocol, doing those key steps. But if we were 6 to 9 months in and a person isn't getting better or they're having major fatigue still, that's at a point where I would start trying to do things to repair and support the mitochondria function. Okay? So how do you fix mitochondria? Well, one thing you want to do in mitochondria repair is you want to fix the membrane of the mitochondria. All right? The other thing that is really important, especially if a person is a vegetarian, is to take something called carnitine. And I liked using a variety of that called acetyl L-carnitine. Okay? And so you have to fix the membrane that gets damaged. You have to take acetyl L-carnitine, especially if you're a vegetarian. If you're not a vegetarian, don't worry about it. You're probably getting enough. But carnitine comes from red meat. All right? So if you don't have any red meat in your diet, you're probably running short on carnitine. And what it's used for is it's used to carry fat from the outside of the mitochondria to the inside so it can be burned into cell fuel. All right. So it's a transport vehicle. And if you are a vegetarian and you have mitochondria injury, then you want to take 500 milligrams twice a day for at least a month, then decrease it down to 1 time a day. Okay. All right. Number 3, take CoQ10. All right. CoQ10 is an antioxidant that acts as a transport vehicle to carry electrons around your mitochondria as part of these chemical reactions, all right? If, however, you are treating Babesia with atovaquone, which is found in Mepron and Malarone, you do not want to be on CoQ10 because it will make it ineffective. It'll make the Babesia treatment ineffective, okay? All right? All right, so repair the membrane, acetyl-carnitine if you're vegetarian, CoQ10 if you are not on treating Babesia with atovaquone, okay? And then the 4th thing is be on a really good antioxidant that gets to the inside of the mitochondria to fix them from the inside, all right? And that's glutathione, all right? Liposomal glutathione, all right? So if a person couldn't afford to do all that, there are 2 things I would have them do is liposomal glutathione, which would be 5 milliliters 1 time a day, and then take something that repairs the fat. Okay, now you have 3 options on that, all right? And that's, there used to be you had 2 options. Now you have 3. All right. And these all come from Research Nutritionals. Number 1, Research Nutritionals has a product called NT Factor Energy. All right. They also have another product called ATP Fuel. And they have a 3rd product now, a new product called ATP 360. And I just want to briefly describe the differences between those, okay? Their product called NT Factor Energy and their product called ATP Fuel have something in it called NT Factor. So both ATP Fuel and NT Factor Energy have in it NT Factor, okay? And NT Factor is a proprietary mix of these fats that make up the covering of your mitochondria. And that product has been researched in a number of studies, and it's shown to give energy improvements and to repair the covering of the mitochondria. Okay, so both NT-factor energy by Research Nutritionals and ATP fuel have NT-factor in them. Okay, they both have nutrients in them that support the mitochondria as well too. And then ATP fuel also has CoQ10 in it. Okay, so the big difference between NT-factor and ATP fuel is CoQ10. All right, and again, remember, if you're treating Babesia with a topicone, you don't want to be on CoQ10. All right, now, my experience, I liked working with NT-factor because I think it was more flexible. It was easier to work with. All right, so you would start at 2 pills 3 times a day for 2 months, and then you go down to 1 pill 3 times a day. ATP fuel was 5 pills twice a day. It was really hard to take, okay? Because of that, Research Nutritionals has come up with a new product. It's called ATP 360, all right? And they're using there's some preliminary research out on it. It's not published yet, but the preliminary research shows that it does improve energy just as well as the ATP fuel and NT-factor. It works as effectively at doing that, okay? But it is easier to take than both of those, okay? Because it is 3 pills 1 time a day, all right? And it also has some ingredients in it that are shown to actually increase the mass of the mitochondria. They're not using NT-factor in it. They're using a different fat delivery system to repair the mitochondria. But their studies, again, show that it does work to improve energy, okay? It does have CoQ10 in it as well, okay? So it is an easier to take version, if you will, of the ATP fuel, although the fat source in it is a little bit different.